Namaskara, I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospitals, 15 Eagle Street, Shantinagar, Bangalore, and I'm an eye surgeon who's gone in for genetic research. Thereby, we give autologous immune booster therapy, giving fetal DNA and fetal stem cells back to the patient from his own blood. Today, with a lot of dryness and environmental pollution and our own habits, our eyes are very dry. With the dryness comes in this feeling of blepharitis or irritation or meibomian gland dysfunction or ocular rosacea. The terminologies may vary, but it is an ocular surface disease. Now, this ocular surface disease needs to be cared about. We need to take care of our lashes. More than 500 years ago, we learned that we need to take care of our teeth and our gums to keep the teeth going for a longer time. Today, we have understood, because in the last 50 years, we have made such rampant progress on computers and video display terminals that we need to learn to take care of our eyelashes. One of the simplest methods to do this would be to take an antibiotic eye ointment, use it as a night cream, not inside the eye, put it on your fingertips and just massage your lashes after you have washed your hands. Just like you use your toothbrush to clean your teeth morning and night before you go to sleep and when you get up, similarly, we need you to use your finger as your toothbrush, the antibiotic eye ointment as a toothpaste, and rub your lash margins on both eyes.